Let's talk first to David Rowland, Director of the Centre for Health and Public Interest. Hello, David. Thanks very much indeed for joining me. Wes Streeting, waging war on waste. This is just the beginning. He's taking an axe to it. Do you think there are many areas of waste that are obvious that need to be weeded out, eliminated?
Well, I think there's always room for improvement within any kind of system. Let's be absolutely honest about that. And I worked for a number of years within kind of some of these quangos. I don't work in them now, so I can, testify to the fact that there's obviously room for improvement. But I think what's kind of quite interesting about the way that Wes Streeting is approaching this, it's very, very similar to the guy that he's criticised, Andrew Lansley, who in 2010 came in and pretty much said the same thing. We're going to cut back on all these quangos, going to have a bonfire of red tape, we're going to get rid of all of these managers. What happened? Well, in the example of the quango that I work for, that was the regulator of social workers. The government announced it was going to close down. It took 2 years for that process to go through, lots of consultation with staff, lots of consultation with ministers. The total bill for closing it down, and this isn't just redundancies, this is other stuff as well, was about 17 to 19 million quid.
Gosh.
5 years later, another minister comes in, decides they're going to have another look at the system, and decided that what they needed to do was to create a specific regulator for social workers. It cost 10 million quid to recreate.
Well, there's 27 million quid of waste right there in just the two sentences you've just uttered, isn't there?
I know, and I think this is one of the things that is never really thought about when you go through these mass reorganizations, making potentially 30,000 people redundant. I don't know if you've ever been through a redundancy process in your own life, but that usually is probably about 10 hours of interviews that happens with staff, consulting them, making sure they're okay, paying them out at the end of it. If you think of all of that time that could be spent on trying to deliver the better healthcare system that we need, then, you start really having to question what actually is the value added of this particular proposal that's coming forward.
All right. So I mean, for many people listening, Dave, they will simply think waste is bad. We definitely do not spend our lives paying national insurance for it to be wasted. That we don't want.
Yeah,
anything bloated, we don't want. Superfluous managers who cost a lot of money, we definitely do not want. Things that are reduplicated unnecessarily, we don't want. And we certainly don't want, flabby contracts with companies that go on for years and years, because it's no one's personal money. Nobody ever checks whether actually you could get it much better, cheaper, more efficiently somewhere else. We don't want that. And we certainly don't want beds blocked by people who don't want to be there. They want to go home and they can't go home because social care isn't there. So there are many, many things we don't want. And when Wes Streeting says, I'm going to wage war on waste, it kind of sounds like he doesn't want exactly what we don't want. He wants what we want. But you're concerned that his plan will just end up ultimately costing us more than it saves us, are you?
I think there's a very strong chance that. So just to look back at what Andrew Lansley did last time, and the previous person that you interviewed from the NHS Confederation pointed out very well. Andrew Lansley came in and said, look, we've got to move the NHS out of political control. And so they created NHS England. It should be remembered, though, that back in 1991, the Conservative government created a thing called the NHS Executive. The same intention of moving management out of central control and moving them all up to a massive office in Leeds. Labour comes in 2002, decides what they're going to do is to reverse that. Andrew Lansley comes in 2012 and reverses that again. And now Wes Streeting is going back round the same cycle.
And this sounds expensive. It sounds like the hokey cokey, but it sounds like an expensive version.
It's a very expensive way of changing a system. And I'd just say this in terms of waste, in terms of the contracts that are available for areas where the government could genuinely look. Yeah. So we looked at the PFI contracts across the NHS, £160 million a year on average is leaking out in those contracts in the form of profit. Now, if I was sitting in Wes Streeting's shoes, I probably would be targeting that.
And just to explain what a PFI means, what's PFI?
Yeah, of course. So basically, PFI was introduced by the last Labour government, and it is a scheme where basically the NHS contracts with a private company to build NHS hospitals. And as a result of that, the NHS is effectively leasing these hospitals back from the companies that
now we get it. Now we get it. And you think
so
those
money
are hemorrhaging money? Really
hemorrhaging
hemorrhaging.
160
David,
million.
thank you very much for setting this all out so clearly for us. Greatly appreciate